Welcome to Thursday's edition of COVID-19. Cluster infections within nursing centres and imported transmissions have pushed Korea's daily tally to above 100 today, with more on the rise as well as on the economic impact of the pandemic later on in our show. Let's start now with our Kwon Soa and the latest COVID-19 numbers. Soa, I hear we have three-digit figures for Korea on this Thursday.
Yes, Sunny, it is the second time that the country reported cases above 100 after the country leveled down its social distancing measures to level 1. And the last time we saw a number above 100 was last Thursday, so exactly a week ago. And we see a rise by exactly 30 cases from yesterday and a similar increase from the day before. And with that, the country now has a total of 25,543 cases. The death toll stands at 453, and for the past 3 days, we had reported 3 fatalities every day. And the number of people in quarantine or under treatment has surpassed 1,400 again, while recoveries are now at 23,647. And now, yes, back to you, Sunny, first.
Right, so I was actually really curious about the latest sources of the infections here in the country.
Well, recent infections are concentrated at risk-prone medical facilities, with cases at a rehabilitation center in rehabilitation hospital, I should say, in Gyeonggi-do province, for instance, rising to 86. And group transmissions among friends and families are continuing to break out as well. For instance, again, in Gyeonggi-do province, a dozen cases linked to a family gathering during the Chuseok holiday, which was some 3 weeks ago, has emerged as well. And that is also why we are seeing this high number of infections in Gyeonggi-do province at 67, followed by 18 cases in the capital, Seoul. And also almost 90 cases are reported in the metropolitan region. So we are seeing another increase in this part of the country. Also 11 here in Chungcheongnam-do province. And this Thursday, we have 17 cases from abroad, which is lower than what we had yesterday, almost half of that, which means domestic cases are above 100, and that's what we're seeing in almost a month. And with that, let's take a look at the international figures now. The US and India have reported some 64,000 and 56,000 cases respectively in the past day, and 26,000 new infections in France, as resurgences in Europe are continuing at almost the same number of new infections in the UK as well. Here now at almost 790,000 infections. And Italy, meanwhile, has surpassed the total caseload of Iraq and Germany, reported for the first time over 10,000 cases in just a day since the pandemic begun. And also the death toll is almost at 10,000 there. And here are the figures for the entire globe: 41.48 million in total, 1.1 million fatalities, and 30.9 million recoveries. And those are the figures I have for now, but I'll be back with more after the government briefing. Sunny?
Right, so I'll see you back at the desk later then. The COVID-19 pandemic has brought about sweeping changes on the diplomatic front and global governance. For more on these changes, I have our Yoon Jung-min here in the studio. Welcome, Jung-min.
Hello, Sunny.
Jung-min, do start us off with the impact of COVID-19 on the diplomatic front. I believe some important meetings were cancelled.
You're right, Sunny. So first, it is affecting dialogue between Seoul and Washington. U.S. Secretary of State Mike Pompeo was originally scheduled to visit South Korea, Japan, and Mongolia earlier this month, but he has canceled his trip to Seoul and Ulaanbaatar after President Donald Trump tested positive with COVID-19. Instead, Pompeo only attended the so-called Quad meetings in Tokyo, along with Japan, Australia, and India. The U.S. State Department said it plans to reschedule his Asia trip later this month, but pundits say it won't be feasible over lingering concerns over President Trump's health and with the U.S. presidential election just around the corner. Pompeo's canceled trip was a blow for South Korea because it was trying to revive stalled denuclearization talks between Pyongyang and Washington before the U.S. election. At the UN General Assembly in September, South Korean President Moon Jae-in proposed a formal end to the Korean War, which ended with an armistice instead of a peace treaty. Little progress has been made on that front since then because of the impact of COVID-19. I actually talked to an expert about this over phone, so let's take a listen.
Especially after President Trump came positive on the coronavirus, the South Korean government's plans to initiate a dialogue for an end of war declaration seems pretty much unlikely for now.
Before President Trump was confirmed with COVID-19, Seoul and Washington have had a series of diplomatic exchanges. Seoul's top nuclear envoy Lee Do-hoon went to the U.S. and sat down for talks with his American counterpart Stephen Biegun, which included discussions on peninsula affairs. Seoul's senior national security official Kim Hyun-jong and Vice Foreign Minister Choi Jong-gun have also made recent trips to Washington. With these moves, South Korea may have been looking to add fresh momentum to the stalled nuclear talks with Pyongyang before the U.S. election, but all of that looks to be in jeopardy now.
I see. Jong-min, what about Korea's exchanges with countries other than the U.S.? How have they been affected by the pandemic?
Sure, Sunny. So there have been reports that China's Foreign Minister Wang Yi was looking to visit South Korea before the end of this month, but sources say that his trip has been delayed indefinitely. They say Wang was scheduled to make his trip to South Korea following Pompeo's original plan to visit Seoul. There was speculation that the trip may have been postponed because Pompeo canceled his own trip to Seoul, but sources say Wang's decision was made due to his conflicting schedule.
Meanwhile, the U.S. presidential election is less than 2 weeks away, and I hear there's already been a high voter turnout for early voters, that is.
You're absolutely right, Sunny. So early voting numbers are hitting records high across the U.S. this year, and this is mostly because of the pandemic. According to the U.S. Elections Project, over 42 million Americans have cast their ballots as of Wednesday. Of them, mail-in ballots numbered over 30 million, and in-person votes amounted to over 11 million. The tracker added, however, that some states do not differentiate between mail-in ballots and in-person votes. The numbers have been described as astounding by U.S. media outlets, and plenty of enthusiasm was on display by American voters who took to the polls early. Take a look.
I wasn't interested in the past, actually, but I think now it's very important to do so.
Well, I was excited. I've been excited for months. I woke up and I was like, it's the 19th. I can go early vote.
The early voting figures may climb even higher with around 2 weeks still left to go until the election day. The numbers are especially high in several key states, including Texas and Florida.
Now, Jong-min, before you go, could you briefly touch upon the key pledges, presidential pledges that is, made by both Mr. Trump and Mr. Biden, respectively?
Sure. So President Trump has expressed his confidence that the U.S. will overcome COVID-19 just as he has beaten the disease himself. But he has continued to hold rallies on his campaign trail, including key battleground states. Take a look at what he had to say at a rally in Arizona on Monday.
Optimism will boom. The pandemic, it's rounding the turn. Vaccines are coming. And I look fine, don't I? You know. And we'll get back to a normal life. That's what we want, just a normal.
But former Vice President Joe Biden and his running mate Kamala Harris are criticizing Trump's COVID-19 response.
Donald Trump was informed in January 28th, of the nature of this pandemic. And what did he do? He stood at rallies and he stood before the American people and he didn't tell you what he knew.
Biden says the U.S. will rejoin the World Health Organization under his leadership and that the U.S. will take global leadership in tackling the pandemic.
I see. All right, Jong-min, thank you for that. I hope to see you again soon.
Thanks for having me.
Right, we turn now to the regular briefing on COVID-19 here in Korea. Local authorities are investigating a number of fatality cases following flu shots to see if there is a link, that is, between these passings and the vaccines. Now, these unfortunate events have sparked public concerns of the safety of the flu vaccination program, but medical experts are firmly calling on members of the public to get their flu shots to prevent a twindemic. We are still waiting for the briefing to commence, and perhaps while we do, we can take a quick look at the guidelines under Level 1 social distancing. No, I've just heard the briefing is about to start. I'll come back to you afterwards with a summary.
We will now begin our regular briefing for today. Let us begin our regular briefing on the COVID-19 response here in South Korea. As of October 22nd, we have a total of 104 new domestic infections and 17 new imported cases. The total caseload now stands at 25,543. Currently, we have a total of 1,443 people under quarantine, and the number of cases with severe or critical conditions stands at 62. We had 3 additional fatalities, and the accumulated death toll now stands at 453. I extend my deepest condolences to the deceased and the members of the bereaved families. Let us now take a look at the updates on domestic infections by region in Seoul's Panagua district. In relation to Sammo Sports Complex, we also have additional cases of 9 being confirmed. A total of 10 people have been confirmed to date. And in Gyeonggi-do province in Gumpo Medical Hospital, and in relation to an Anyang City medical hospital as well, we also have 23 more cases being confirmed, and a total of 26 have been confirmed to date. And in Gyeonggi-do province in Yangju City, in relation to a textile company, we have the first index case confirmed on the 19th, and we have additional cases being confirmed. A total of cases have been confirmed stands at 7. And in Gyeonggi-do province in Gwangju City, in relation to the SRC Rehab Hospital, we have 20 more cases, and the total cases now stands at 106. Among them, 35 are patients, and 43 are caregivers and care workers, and 43 are also the staff members. And in relation to Chungnam University Hospital in Daejeon City, we also have 3 additional cases being confirmed. A total of 4 people have been confirmed to date. And in Cheonan City in Chungnam Province, we also have a social gathering, and we also have 9 additional cases in relation to the social gathering. A total of 10 people have been confirmed to date. And in Busan City, in relation to an on-nursing hospital, we have the first index case being confirmed on 20th, and we have additional cases being confirmed, and a total of 3 people have been confirmed to date. And also staying in Busan City, in relation to the Haedarak Nursing Hospital, we have 3 additional cases being confirmed. A total of 84 have been confirmed to date. Among them, 68 are patients, and 8 are caregivers and care workers, and 7 are healthcare workers. And as for other detailed cluster infections, please make your inquiry to the spokesperson office after the briefing. Today we have seen major infections, especially centering around the SRC Rehab Hospital, and we have seen a major surge in the number of this case. And at the SRC Rehab Hospital, when we initially identified the infections, we have noted that the virus has spread through various wards in the city, in the hospital, and we also have high possibility of further infections breaking out from the hospital, and we will also continue to exert our full efforts to secure the lives and the safety of the patients there. And also in Seoul and Gyeonggi-do province, in relation to the nursing hospitals as well as mental hospitals, we are also conducting a massive testing on all of the caregivers as well as inpatients who are admitted to these hospitals. First, we will give you the updates, and we will also brief you on the status of Seoul first. In the Seoul city, from the 19th to 20th, we have carried out about 30 hospitals were subject to the testings, and a total of 2,400 people were tested. And we have 1 person being confirmed in Yeongdeung-Pogu district, and we are carrying out investigations as well as quarantine and disinfection for this specific hospital. Today, we also note that the smoking is also a main risk factor for COVID-19. And I tell you this because we have seen high risks of infections, especially at many of the venues that are frequented by young people. And therefore, we would also like to give you specific guidelines as well as the importance to take precautions. And aside from the COVID-19, we are well known of the side effects and the detrimental effects of smoking. However, we have known that smoking also plays a crucial role in determining the critical severeness of the COVID-19. First of all, smoking can also be detrimental and it can harm your lungs. And when the COVID-19 infects a smoker, this patient would have a lower resistance against the virus. According to a data released by WHO, we see that smokers have twice much of the infectious rates compared to the others, non-smokers. And also, if you smoke, your hands are also close to your face, meaning that you have higher risks of infection there as well. And also, when you are smoking through your mouth, you also have higher risk of infection as well. In particular, in a smoking room, because this is a confined space, the risk of infection is even higher. And the agency, we would also like to note that from many of the venues that have also had witnesses cluster infections, we are carrying out in-depth investigations. And we currently identified that smoking itself is a very dangerous risk factor when it comes to COVID-19 infections. Well, we tell you once again, but WHO has determined and has designated smoking as one of the most detrimental aspects of the COVID-19 as well. Of course, for smokers, it is very difficult for them to also quit smoking. However, please understand and please remember, at a time when COVID-19 is also very dangerous, especially for smokers, we ask the smokers to quit smoking as well. And globally, we have seen increased number of the confirmed cases. Please wear your face mask at all times and please wash your hands thoroughly. Thank you very much.
Right, that was Lee Sang-won at the Central Disease Control Headquarters with Thursday's briefing. So he appeared to have spoken at length about smoking and COVID-19.
Yes, because there were earlier studies and questions about whether the relation between smoking and coronavirus infection. So although these studies are not complete yet, he did mention that there seems to be a higher risk of infection among smokers, and also it's bad for the smoker, him or herself, if they do get coronavirus, because smoking, of course, is bad for your lungs, but also coronavirus that involves respiratory symptoms. And also he had some analysis or the results of the massive screenings conducted at medical facilities such as nursing hospitals in the metropolitan region. He first had the results of the capital Seoul, where so far 30 facilities have been tested, meaning people working there and also patients. And out of over 2,700 people, one person has tested positive for the coronavirus. And speaking of hospitals in Gyeonggi-do Province's city of Gwangju, the SRC Rehabilitation Hospital added 20 more infections, so the total stands at 106. And the Haedarak Hospital in the city of Busan also has 84 patients. So the trend seems to be that these recent cluster infections are more and more continuing to appear at medical facilities, and also the incubation period at many of those is still not over. So it's likely that we see this number rise in the coming days.
I see. All right, so thank you for that. I'll see you again tomorrow.
See you tomorrow.
Right, every cloud is believed to have a silver lining, and a rather strange silver lining about the pandemic is the reality that it has offset other common illnesses and also given the Earth a chance to breathe, if you will. To take a look.
The COVID-19 pandemic has left wide-ranging social and economic challenges in its wake. Somewhat surprisingly, however, the outbreak has also led to a few unexpected benefits.
코로나의 역설이라고 할 만큼 코로나19 유행 이후에 다른 감염성 질환은 크게 유행이 줄었습니다. 이는 국민들께서 손 씻기, 마스크 쓰기 등 개인 방역 수칙을 철저히 실천해 주신 그런 덕분이라고 생각합니다.
Since the beginning of the COVID-19 outbreak in Korea, the number of patients suffering from other infectious diseases has fallen drastically. Data from the National Health Insurance Service shows a sharp decline in the number of patients with hand, foot, and mouth disease, as well as chickenpox. Korea also had a milder flu season compared to last year, having witnessed a shorter influenza season and a fewer number of illnesses.
2019년에서 2020년 유행은 전체 기간은 20주로 확인이 되었고요. 이런 기간은 전년도 유행이었던 32주였던 것에 비해서 12주 빠르게 종식이 되었고 이번도 약 52%, 그러니까 반 이상이 감소를 하였고요. 공중보건학적인 여러 방역 정책들이 인플루엔자를 비롯한 다양한 호흡기 바이러스를 줄이는 데 크게 기여를 했다고 생각이 됩니다.
Efforts to curb the spread of COVID-19 has also led to a few unforeseen and fortuitous outcomes in other countries around the world. In the early part of 2020, at the height of the COVID-19 outbreak in China, lockdowns were imposed in Wuhan and other regions. According to a joint study by a team of researchers from China, the US, Japan, and the Netherlands, China reported 60,000 fewer patients with respiratory ailments as a result of the lockdowns.
There's a couple different ways of looking at those impacts. One of them is there's about 60,000 reduction in what's called morbidity incidences. Air quality is a very significant health hazard. It's the 5th highest mortality risk factor, and it's associated with about 5 million deaths in 2017 alone. Furthermore, when you get an emission of pollution in one place, it affects not only the people there, but it can affect people that live far away.
China wasn't the only country that saw improvements in its air quality. Research on the air quality of 34 countries also showed a collective decline in air pollution, which are being attributed to the same factors.
Surprisingly, we found very large reductions, even more than we expected, I think. So we found a 60% reduction in nitrogen dioxide concentrations, population weighted, as an average for these 34 countries. And we found a 30% about reduction in particulate matter concentrations. So we are quite confident that reduced transport is a main cause of the reduction in air pollution. Of course, in many regions, some industrialized regions, like in northern Italy, in China probably, also the lockdown of industry and other economic activities has affected the reduction.
In spite of the challenges posed by COVID-19, experts say it has also opened a window of opportunity to address the long-standing issue of climate change.
We could say, actually, this is a really good opportunity to make different choices, to tackle the pandemic, to create a more resilient world, a more resilient future for everybody, create jobs, create industries, tackle climate change at the same time. So it's a real choice point, and it's up to governments to make those right choices, and it's up to all of us to encourage them to do so.
Efforts to curb the spread of COVID-19 have yielded unexpected benefits, especially on the environment, to help mankind create a better future for the world of tomorrow.
코로나19 재확산 영향으로 음식 숙박업과 도소매업 등 대면 서비스업을 중심으로 8, 9월에 소비가 위축되며 고용 충격이 심화된 데 주로 기인합니다.
지금이 경제 반등의 골든 타임입니다. 경제 활력 제고를 위해 범정부적 노력을 대가할 시점입니다.
In today's studio session, we reassess the economic consequences of the pandemic here and elsewhere, especially in light of the fresh outbreaks in Europe and the US. I have Professor Yang Hee-dong from Ewha Women's University. Welcome back, Professor Yang.
Hi, good afternoon. Thank you.
And I also have Professor Oh Jun-seok from Sookmyung Women's University. Pleasure to have you back, Professor Oh.
Thank you for inviting me.
Right, Professor Yang, hopes for an economic rebound were high on the local front up until July. And then back in August, we had the repercussions of a prolonged monsoon season and, of course, a resurgence in cases. And these put a damper on such hopes. What is the state of the local economy at the moment and that of domestic consumption as well?
Well, I should tell that there are some of the mixed results in both of August and September. In August, we have, if you take, take a look at the breakdown of the consumption between the service and the physical goods. The service industry has decreased by 1.0% in August, but increased by 3% in the physical goods, being led by the durable goods. But in September, we also have very mixed consequences because in the first 2 weeks in September, we have very, very dramatic decrease of consumption. Whereas, because we had very strict, social distancing in the first 2 weeks of the September. But setting in the third week, we have observed a very abrupt increase of consumption because, there is a big holiday season in Korea. So lots of people have spent a lot of money to prepare for their, Chuseok holidays. For example, for the credit card consumption in the first 2 weeks of September, the decrease rate is about 2% in the first week and 7% in the second week. But setting in third week, we have about an increase of 5% and another 5% in fourth week. But in the fifth week, we have almost 4%. And more dramatic increase in the consumption in the department stores. In the fifth week of September, we have increase of 25% of the consumption in the fifth week of September because lots of people love purchasing in department stores.
I see, because they couldn't travel overseas.
Right.
Oh. Professor O, as Professor Yang mentioned, the tougher social distancing measures that were put in place to deal with the resurgence that began in mid-August also dealt a severe blow to the job market.
Yes.
Please tell us more about this.
Yeah, I have a special meeting for my students at the university yesterday. That is because the job matching rate has plummeted. From the 65% on average at my university to the below 50%. So Bureau of Korea Statistics tells unemployment rate 3.1% in August, 3.6% in September, 0.5% point up and up. What is worried about more is the unemployment of young workforce from age 15 to 25. Soared up from 7.7% to 8.9%. The number of unemployed reaches over 1 million. And then it means a 13.1% increase compared to the months from the same months from the previous years. Hard attack against the female workforce, part-time workers and workers of age over 40 years old. And then job affordability has dried up in the sector of construction and then services such as retail sales and then hospitality and then food and beverage, not to mention of the manufacturing services. We have to face the fact that how difficult it is to rekindling the economic activity aftermath of this kind of pandemic. And quite recently, Bank of Korea freezed the reference rate at 0.5% again, even in the middle of the economic recovery is on the way. Bank of Korea might try to tell the story that it will take time yet to clear up all the business uncertainties and then which happens and then delays the decision making of investment and then consumption. So private sector, we have to wait for more time.
I see. Professor Yang, on a slightly bright note though, exports, which are the driving force of Korea's economy, are seen to be picking up, I hear. Could you tell us a bit more about this?
Well, we have very dramatic good news about the export in September. Because in September, we have about $48 billion of export, and daily average is about $2.1 billion. So we have $9 billion of trade balance in profit, which is 5-month consecutive profit. But these numbers have a very humongous meaning, right, in our current economic state. The first one is these numbers. I mean, total export and daily average is the best performance in this year. And also the monthly growth rate, 7.7%, is the largest record in the past 23 months since October 2018. And we used to have these numbers like over the $40 billion of exports and over the $2 billion of daily export. It's a typical pattern before the COVID-19. So someone even go further to argue that we finally recovered the typical pattern in export. I'm not sure whether that is true. And number 4 is this is the stoppage of 6 months consecutive export negative growth starting in March. And main number 5 is we have the growth of export in 4 big markets, which are China and ASEAN and EU and US. And the dramatic growth was in US and the psychological growth was in EU. So I can tell that these numbers are very, very promising. But we should keep in mind that this growth, export growth, has been very centralized in particular areas, such as biohealth and computers and semiconductors, which has benefited a lot from the COVID-19. So bio or computers, well, we need to have a lot of other areas to realize the growth for through the export.
Well, staying with that optimistic tone, officials here, therefore, are hoping for an economic rebound in the 4th quarter of this year. So what are the chances of such a scenario? I have Andreas Bauer from the International Monetary Fund live on the line with more on that. Hello again, Mr. Bauer.
Hello, nice to be with you.
Right, Mr. Bauer, the IMF disclosed its October World Economic Outlook for 2020. Now, back in June, your organization projected Korea's economy to shrink by 2.1%. What is the latest forecast?
Yes, so in our latest report, we have been able to slightly improve our forecast both for the world economy and for Korea. For the world economy, we're now expecting a contraction of 4.4%, which is somewhat less than the 5.2% contraction that we expected in June. For Korea specifically, our latest forecast is a contraction in real GDP of 1.9%. So Korea will suffer a recession, but the recession will be significantly milder than what many other countries around the globe are experiencing.
I see. Professor Oh, I believe you have a question for Mr. Bauer.
Mr. Bauer, good to see you. OECD and Korea Development Institute has kept a pessimistic and gloomy sign on the Korean economy even ever since the second wave of COVID-19 pandemic. While IMF updated recently its forecast of GDP growth rate of Korea to minus 1.9%, which is 0.2% percent point higher than the previous economic outlook of June. Could you tell us more about this adjustment? What lays negatives and positives behind this adjustment?
Certainly, Professor. So I think there's basically 2 main factors that explain our slight improvement in the outlook. The first factor is that since June, the Bank of Korea and the government have continued to provide quite a bit of policy support to the economy. Especially, I would mention the approval of the 4th supplementary budget very recently. And we think that will give support to domestic demand through the end of the year. The other factor is the one that Professor Yang just mentioned, which is the strong export performance we have seen in the last few months, which in turn reflects also a somewhat stronger recovery in the main trading partners of Korea. And that also has given us some reason to be a bit more optimistic this year. Now, I would like to caution, though, that the uncertainty surrounding growth forecasts in the current pandemic environment is very large, much larger than what it would usually be. So there are risks up and down, of course. And I think it is possible that the contraction will be smaller than what we forecast, especially if that positive export trend will continue. But we also have factors that could go the other way. And here I would say especially the resurgence of coronavirus infections, both in Korea and also in main trading partners, would be a factor that could weigh on the forecast and could tilt it to the downside.
Right. Mr. Bauer, economic growth forecasts for the year 2021 were also shared, but these figures were lower compared to those of this year. Could you please explain?
Yeah. I think we're still projecting a fairly robust recovery of the Korean economy. It has already started, as you mentioned earlier in the panel, and I think it will continue for the whole year next 2021. We are expecting 2.9% growth. That's 0.1% lower than we had in June. And I think the main reason for that is that overall, we don't yet see a significant increase in the underlying capacity of the economy to grow through the end of next year. We think that some of the restrictions to growth will continue to linger next year, especially social distancing and some of the international trade restrictions. And there'll be also some scars. There'll be jobs lost. It will take time for them to recover. So to make a long story short, we broadly see the same recovery we saw in June. It's going to be slightly more front-loaded maybe than what we had in mind earlier.
Mr. Bao, during a conference call yesterday, that would be Wednesday here in Korea, between Seoul's top finance official and the head of the IMF, the latter spoke about how Korea had suffered the least amount of economic damage from the pandemic among OECD member states. Do you see such assessments as positively affecting Korea's economy moving forward?
Yes, certainly. I think there is a lot of empirical evidence that shows that countries that suffer recessions or suffer economic crisis actually have permanent output losses. So the economies will, of course, recover, but they don't recover quite to the level where they would have been without the crisis. And there are many reasons to this. In a crisis, investment falls. In a crisis, intangible capital of firms gets lost when firms get bankrupt. And also workers, when they're out of the labor force, their skills tend to erode. Now, the magnitude of these permanent losses is directly linked to the extent of the crisis. And so countries that have a more shallow recession, like we see in Korea now, they certainly will also have smaller permanent output losses than countries that have a much larger declines of real GDP. And as I mentioned before, there are many other countries that see much more dramatic declines in the current year.
Right. Mr. Bao, one final question before you go, a short answer if possible. What are some words of advice that you would give on perhaps policy directions to better cope with the fallout from the pandemic in the future?
Yeah, so let me limit that to two. Well, the first one, I think, is not to withdraw the policy support prematurely. So monetary, fiscal, and financial sector policies should remain accommodative until the recovery is really firmly entrenched, and that'll certainly not be until sometime next year at the earliest. So that is, I think, the first task for the countries. And then I think the second task is that countries should go ahead and move on reforms that will increase the underlying capacity of their economies to grow, and so that they can actually ameliorate some of these scars that I mentioned earlier that happen in a crisis. And of course, the agenda depends a lot on the countries, but basically what we have in mind there is steps to strengthen the social safety net, steps to keep workers engaged in the labor market so they don't drop out, steps to improve the investment environment, to reduce administrative burdens, reduce regulations so that investment can pick up. And then also steps that will allow firms to enter markets in growth sectors so that they can support the recovery.
I see. All right, Mr. Bauer, again, thank you very much for making the time to join us live at this hour with your thoughts.
My pleasure. Thank you.
Right, Professor Oh, given the measures proposed by Mr. Bauer to address the economic challenges of the pandemic, which do you suppose can be explored by Korea?
Mr. Focusing on the Korea's steady performance on the export, yes, it is true the global economy is climbing out from the depths to which it has plummeted during the great lockdown. It all comes down to the jobs. A job determines the success and failure of the economy, and then it is a matter of bringing bread to the table. And one thing to add is the quality job. People believe that the good technology can create good quality jobs. So as a guiding star, leading economy, the big data, AI, and then other digital technology would be measured to be considered whether or not to meet the condition of the investment in the private sector is very crucial for the job opportunity in Korean economy.
Right. Professor Yang, officials here are resuming their discount coupon scheme, which was halted back in August because of the resurgence. And this scheme seeks to boost consumer spending, of course. What are your thoughts on the impact of such efforts?
Well, I think this is a great and very cute idea because in June, the Korean government has prepared the third revised supplementary budget. And in the plan, and they had the ideas of the discount coupons worthy of about $150 million. And they thought that probably more than 16 million people could benefit from these ideas. And these people are a lot because that population takes up about 1/3 of our entire population. And these 8 sectors that may benefit from these discounted coupons are related to service, entertainment, and leisure that has been constrained and restricted by Korean government for the past months. For example, accommodation, tours, exhibition, the movie, and performance, sports, dining out, and agro-fishery food. These are great beneficiaries from this discount coupons. I do believe that it really helped to help recover the consumption in these 8 areas.
Right. And despite that, Professor O, despite what Professor Yang has just said, there are concerns and there are some people who are claiming that efforts to revive the economy are taking place too quickly. How should we seek a balance between efforts to revive the economy and perhaps to ensure the safety of the public amid the pandemic?
It's a really important question. And simply speaking, quarantine measures might be breakers in the economy. So you cannot go forward when your foot on the brake pedal. But what is not surprising is you cannot speed up without brake installation, which means the quarantine measure is also needed. So for Korean economy, that the Korean economy have to take this kind of conservative approach to balance the quarantine and then economy. But it is time to consider to gather and then the industry players to make a form, something like an innovative team in the finance field, healthcare field, and some manufacturing field to tap into the digital technology as a gaining momentum of the economic growth in Korea.
Right. Professor Yang, neighboring China is noting a V-shaped recovery. How do you explain its economic stability, relative economic stability that is, with its counterparts worldwide? And what impact does that look to have on Korea's economy?
Well, I do believe that it really helped the recovery of the Korean economy because the Chinese tourists to Korea has been reduced about more than 97% compared to the previous year. So we need to invite more Chinese people, right, to spend their money through the tours or whatever in our country. But in China, in September, their GDP has increased about 4.9%. And that number is very dramatic because in the first quarter, their GDP has been decreased by more than 6%. So the cumulative GDP is about $11 trillion, which is very close to the last year performance. So many people, estimate that China may have realized similar levels of GDP and GDP growth, as last year. Many people have positive impacts from the China on the global economy, not just about the Korea, but also entire the Asia and also the global economy as well.
I see. Professor O, as we saw in the video before the start of our talk, we had President Moon Jae-in claiming that now was the golden time to seek to stabilize the Korean economy. Now, what are some variables to keep in mind amid this task, and how can they be overcome? I understand it's a tough question.
Yeah, I totally agree with President Moon. And then it is now the golden time for the boost of the investment. But the private sector is sagged down, so it is time. And then the full liability for the public sector or the government have to make a huge amount of public investment as an igniter to the economy.
I see. What are your thoughts on that, Professor Young? Very briefly speaking, how can we overcome some of the variables in our way to recovery?
Well, the first thing is we should be really careful, for this, the COVID virus, because again, if we have recovery, there was a return of the government restrictions over the hanging out or economy, that may cause another second wave of bad impact on our economy. So we should be really, really careful in our behaviors and socializing, right?
Okay. All right, Professor.
To go out.
Right. We have to be careful. Keep social distancing in mind as well.
Right.
All right, Professor Young. As always, thank you for your thoughts.
Thank you.
And Professor Oh, thank you for being with us today.
Thank you.
Right, on that note, we say goodbye today. Be sure to tune in tomorrow at this hour as we address a host of concerns related to the flu vaccines, imported cases, and herd immunity. In the meantime, do take care, and thank you for watching.